our meeting of the Ottawa Board of Health. I just a couple of quick housekeeping because we are doing it virtually again. So anybody participating on Zoom, please keep your microphones on mute unless called upon to speak. Those participating by phone, please keep the phone on mute at all times unless called upon to speak, and do not put the phone on hold. And please avoid using the speakerphone when speaking. Please speak directly into your device's microphone on your telephone receiver. I will now ask the board secretary to conduct the roll call, please.
Member Banham?
Present.
Member Coutier?
Present.
Vice Chair Di Giovanni?
Present.
Chair Aglai?
Here.
Member El Shanti?
Present.
Member Gower?
Here.
Member Kavanaugh?
Here.
Member Lakin?
Present.
Member Menard, who is just trying to log in, so he should be on the line momentarily. Member Pinel?
Present.
And Member Tilley.
Present.
You have quorum, Mr. Chair.
Excellent, thank you. I'm just going to go over again some of the procedures for the meeting since again we're on Zoom. So the following procedural guidelines are being implemented to promote orderly proceedings of this virtual meeting. Attendance. Should members need to leave the meeting, they should advise verbally they're doing so before clicking on leave meeting from the Zoom platform or ending their call if participating by phone. Speaking order, I will provide each member with the opportunity to ask questions or comment. Members will be called upon to speak in the order set out in the board's secretary's voting list. The usual 5-minute limit will apply. Should you not wish to speak on any given matter, you may decline verbally when your name is called. For voting, if a full recorded vote is not taken for a given item, I will specifically ask if the item is carried and then call for dissents to ensure that all votes are properly registered. Welcome, Member Menard. Points of order, privilege or challenge. Procedural interjection should be kept to a minimum to ensure the meeting proceeds smoothly and to minimize confusion. For points of order where you have not been called upon to speak, please state your name aloud for the record before stating your point of order. Recess should technical difficulties or any other unforeseen matters require a recess during the course of the meeting. Unless the board secretary issues new instructions, members are requested to remain on the line. The board secretary will mute all participants in such an instance. I don't believe there are any declarations of pecuniary interest. Going once, twice, 3 times, okay. Could we confirm the minutes of the meeting of September 21st, 2020, please?
Okay.
Thank you. We received 4 communication items have been received and they'll be held on file with the Board of Health Secretary. Can we receive the communications as noted in the agenda, please?
Received.
Thank you. I'm going to ask Member Tilley, please, to move the motion to introduce reports.
Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health Submission to Health Canada on Proposed New Regulation for Supervised Consumption Sites and Services, 2021 Ottawa Board of Health Meeting Schedule and Performance Appraisal of Medical Officer of Health in camera, personal matters about an identifiable individual, reporting out date, not to be reported out, be received and considered. And be it further resolved that the rules of procedure be suspended to receive and table the report titled 2021 Draft Operating Budget for the Ottawa Board of Health.
Motion carried.
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 Thank you. We'll now go through the consent agenda process. For those participating or watching from home who may not be familiar with this process, I will list each item on the agenda. And for any items where board members don't have any questions or concerns, and we don't have public delegations registered to speak, the board may carry or receive those items on consent, which is to say without any discussion. So number 1 is the Chair of the Board of Health verbal report. We'll hold that. Medical Officer of Health verbal report. We'll hold that as well. Number 3 is the 2021 draft operating budget for the Ottawa Board of Health, tabling, and we have a presentation. And of course, we will take any questions at that time as well. So we'll hold that as well. Number 4 is the Ottawa Public Health submission to Health Canada on proposed new regulations for supervised consumption sites and services. Does anyone wish to hold that item?
Receive.
Okay, received, yes. Okay.
We need to carry the item, Chair.
Oh, we need to carry that, sorry. Carried then?
Carried.
Thank you. Number 5 is the 2021 Ottawa Board of Health meeting schedule. Received?
Carried. Received.
Carried, please.
Oh, sorry.
It needs to be carried.
Okay, everything needs to be carried. Okay, carried?
Carried.
All right. Number 6, performance appraisal of the Medical Officer of Health, in-camera personal matters about an identifiable individual, reporting out date not to be reported out. Does anybody feel we need to go in camera, hold this and go in camera?
No.
No?
No, carried.
Okay, carried. Okay, thank you. All right, we will go back then and I will start with my verbal report then. So I'd like to begin my verbal update this evening by thanking the families for their efforts in celebrating recent holidays, both Thanksgiving and Halloween, differently this year in order to reduce the risk of COVID-19 transmission in our community. We know it isn't easy, and we appreciate the thought and creativity that went into making these celebrations safer. I'd also like to thank local businesses for the cooperation in the face of the latest provincial restrictions that saw Ottawa move to a modified stage 2. Businesses have put a lot of thought, effort, and resources into ensuring safer operations, and they've sacrificed a lot. Not only do small businesses make our economies more vibrant and welcoming, they're also the backbone of our economy. For these reasons, we are also grateful to residents for continuing to support local businesses in any way that they can, whether it's by bundling up to enjoy a meal or a drink on a patio, ordering takeout, purchasing gift cards for later use, shopping local as we move into the holiday season, or sharing the link to a local business's website or social media account. Every little bit helps, and we thank you all for sticking with us during these very challenging times. As members know, the previous extension to the temporary mask bylaw approved by City Council this past summer was set to expire on October the 31st. For this reason, on Wednesday of last week, City Council approved a motion brought by myself and Councillor Sudds to extend the temporary mandatory mask bylaw until the day after its first regular meeting of 2021. The rationale for adopting the bylaw this past summer was based on increasing evidence that wearing a mask when in enclosed public spaces is an important measure in reducing COVID-19 transmission, particularly in situations where physical distancing may be difficult. Given recent trends with the number of people testing positive for COVID-19 in our community and the risk of transmission being ever present, City Council felt that the temporary mandatory mask bylaw continued to provide a reasonable, practicable, and effective method of limiting the spread of infection for the health, safety, and well-being of Ottawa residents. As has been stated before, mask use in areas where physical distancing is difficult to maintain is an important part of the other critical public health measures, as are physical distancing, good hand hygiene, and staying home when sick. Throughout the pandemic, data from hospitals, community services, and surveys have highlighted that Ottawa residents are experiencing worsened mental health and emotional well-being, loneliness, weaker community connectedness, and elevated risks related to substance use, opioids, and suicide. It is very important to highlight that in addition to the ongoing mental health support OPH has continued to provide during the pandemic response, there's important work continuing to reduce the harms of substance abuse. An important piece of this work is the upcoming Ottawa Community Action Plan Virtual Summit. In 2019, more than 200 community members came together to share ideas and make a plan to reduce the impacts of the opioid and substance use crisis in Ottawa. Together, the Ottawa Community Action Plan was created, and since then, diverse community and national partners have continued to lead on the actions outlined in the plan. Great progress has been made in some areas, and others require our renewed energy and commitment to move forward in a world that is drastically different than it was just a year ago. To support the goals and actions in the Ottawa Community Action Plan, Ottawa Public Health, the Community Addictions Peer Support Association, the Canadian Centre on Substance Use and Addiction, and the Canadian Public Health Association will be hosting the Ottawa Community Action Plan Virtual Summit on November the 20th, 2020 from 8:30 a.m. till noon. I encourage board members to participate in this important event and look forward to providing a further update on it at our next Board of Health meeting. Another important piece to share with the board is the recent announcement of funding for the Safer Supply Ottawa program through Health Canada's Substance Use and Addictions program. OPH, along with its partners, Pathways to Recovery, Recovery Care, Ottawa Inner City Health, Respect RX Pharmacy, the Somerset West Community Health Centre, and Sandy Hill CHC strongly believe this program will save lives and better the conditions for individuals who are dependent on the illegal toxic drug supply. As evidenced in emergency department data and national mortality rates, the opioid crisis continues to cause significant harm at a population level and has been further impacted by the increasingly toxic illicit drug supply. The COVID-19 pandemic has further exacerbated many of the issues faced by members of our community who use drugs. It is also evident that an alternative approach is required to reach individuals whose needs are not currently met by more traditional programs and services. We want to thank Health Canada for their commitment and leadership in helping us address this problem. That concludes my verbal update. I'm happy to take any questions. I don't see anybody raising their hand, so I'll assume that there are no questions. I'll ask that the board vote to receive the chair's verbal report. Received, thank you.
Received.
I'm now going to ask Dr. Etches to please provide her verbal report.
So good evening, Kwe, Enge, Townshi, bonsoir. In tonight's verbal report, I'm going to give an update on recent City Council decision on climate action, our fall influenza immunization campaign, the work of local Ontario health teams, and ministry reporting requirements. And I will end with outlining a new approach that we need to be taking to learn to live with COVID, to coexist with COVID with care. So starting with the Council decision on climate action. Members may be aware that Council declared a climate emergency in 2019, and they approved the Climate Change Master Plan in early 2020. It included short, midterm, and long-term community targets for reducing greenhouse gases. And the climate change plan had 8 priority actions. They were to be implemented over 5 years to meet these targets. And the first of those priority actions was implementing energy evolution. So it's Ottawa's community energy transition strategy. So I'm pleased to share with you that last Wednesday, the Council unanimously approved energy evolution and the associated spending plan. This is a major step forward because it sets the framework to achieve Council's target for reducing greenhouse gas emissions by 100% by 2050. And Ottawa Public Health has been a key stakeholder in this plan to advance the board's strategic priority of healthy communities by design. Reducing greenhouse gas emissions will support health and well-being in terms of reducing respiratory illness, contributing to improved physical and mental health, and supporting a healthier built and natural environment. And the work also aligns with the direction we're provided by the province through the Ontario Public Health Standards, the Healthy Environments Program Standard, and it will help inform our own work on climate change. Ce travail s'aligne également avec l'orientation fournie par la province, par le biais de la norme du programme des environnements sains, des normes de santé publique d'Ontario, et contribuera à éclairer le travail de santé publique en Ottawa sur le changement climatique. So with respect to our fall influenza immunization campaign, the Ottawa Public Health run flu clinics began operating this past Thursday, October 29th, at 6 fixed locations across our city. The fixed locations ensure our ability to incorporate the COVID safety measures, such as appointments and managing the client flow, avoiding crowding, physical distancing in terms of the clinic layout, the enhanced environmental cleaning, staff and client screening, and many more. There's a lot that has changed about how we run the clinics. And the goal of this year's influenza vaccination campaign is to surpass our previous year's percentage of the population that gets immunized. We're working to reach individuals who are at greatest risk, including those facing barriers accessing influenza vaccine. So this year, our immunization outreach to those living in congregate settings, such as group homes and shelters, has increased by over 50% compared to last year. And we're pleased with the uptake so far for our community clinics. Demand continues to be high. We've released over 200,000 vaccine doses to providers, including physicians, hospitals, and long-term care homes in the city. More than 6,200 residents were vaccinated in the first 4 days of the Ottawa Public Health community clinics. And so currently there are 2 types of vaccine available as part of Ontario's Universal Influenza Immunization Program. There's the high dose trivalent or TIV vaccine and the standard dose or quadrivalent QIV vaccine. And the idea that people over 65 have to have the high dose vaccine or that they should wait to be vaccinated if the high dose vaccine is not available is a myth. Both the quadrivalent QIV and the trivalent TIV vaccines protect against the flu. The most important thing is for older adults to be immunized. Nous sommes heureux de l'intérêt manifesté jusqu'à présent. La demande de vaccins intégrés reste élevée cette année et plus de 200 000 doses de vaccins ont été distribuées aux prestataires, notamment aux médecins, aux hôpitaux et aux établissements de soins de longue durée de la ville. Plus de 6 200 résidents ont été vaccinés au cours des 4 premiers jours dans les cliniques communautaires de SPO. And I want to thank the City of Ottawa, Parks and Recreation and Culture, and the Ottawa Public Library for providing our flu clinic venues. And I also want to thank the many city departments who provided us with 50 staff supporting logistics and information technology and other ways to support this year's influenza campaign. Moving on to the work of local Ontario health teams, as mentioned at our September meeting, they're an important vehicle for shaping the COVID-19 response and meeting the needs of local communities. We know there are residents whose socioeconomic circumstances create barriers to preventing COVID infection and transmission. And the Ottawa Health Team has responded by creating a process to identify individuals who face language, financial, or other barriers and refer them to community health centers for additional support. These supports include access to testing, shelter, housing, food, mental health services, to name a few. This will ensure that people who face barriers to testing or who cannot easily self-isolate are enabled to do so. Ottawa Public Health is identifying people who could benefit from this additional support, and we provide that information to the community health centers. And we'll continue to refine and expand this process in the weeks ahead. SPO identifier les personnes qui pourraient bénéficier de ce soutien supplémentaire et fournir ces informations au centre de santé communautaire. Nous continuerons à affiner et à étendre de ce processus dans les semaines à venir. Also, through the Ottawa Health Team, Ottawa Public Health Neighbourhood Engagement Team is working directly with community health centres and other local agencies within communities most impacted by COVID-19. This collaboration is facilitating additional allocation of resources to the community and providing a channel for communities to express their needs. A recent community conversation hosted by the Ottawa Local Immigration Partnership, or OLIP, was a forum to share data from Ottawa Public Health and to build an understanding of the experience of racialized and immigrant communities and discuss ways we can work together to reduce challenges to health within these communities. And Ottawa Public Health is working closely with OLIP to enhance our internal capacity to work alongside community members. Next, the brief update on the Ministry of Health reporting requirements. So Ottawa Public Health, the Ontario Public Health Standards identify the expectations for public health programs and services to be delivered by Ontario's local boards of health. And boards of health are accountable for implementing the standards, including the protocols and guidelines referenced therein. The Ontario Public Health Standards includes an accountability framework, which sets out the ministry's expectations of boards of health to promote a transparent and effective accountability relationship. The accountability framework is supported by a number of planning and reporting requirements, which public health units submit to the ministry according to established timelines. Board members may recall that last year we brought forward reports in April and September to inform the board on our reports to the ministry. This year, due to the ongoing COVID-19 pandemic, the ministry amended the requirements and the timelines for submitting reports, which has in turn affected our timelines for reporting to you, our board. So we're currently preparing a report due to be submitted to the Ministry of Health by November 13th. It will identify the most important risks faced by our health unit this year and the potential severity of these risks, as well as plan with strategies to mitigate their impact. So board members won't be surprised to learn that for 2020, the risks we will be reporting are largely related to the COVID-19 response. We'll be identifying financial pressures arising from the need to respond effectively to the ongoing pandemic. And we'll also be reporting on demands related to information technology, our IT systems that relate to having real-time data generation and reporting, our communications, the requirements associated with supporting a mobile workforce, and taking advantage of emerging technologies. And lastly, we will be reporting on the very real human resource impacts of the demanding and uniquely challenging work and workforce fatigue. Given the timelines and competing demands, work on this analysis is ongoing, and so we will make our submission to the province on the November 13th deadline and bring forward a report to you, the board, at the November 30th meeting to give you more detailed information on risks to our organization. So now back to COVID again. I have written to the mayor describing the need for a new approach to the pandemic response for the sake of the population's health. We need to be learning to live with COVID, to coexist with COVID with caution. So as members know, on October 9th, the Government of Ontario announced additional public health measures in Toronto, Ottawa, and the Peel region. These modified stage 2 restrictions came into effect on October 10th, and they're to be in place for a minimum of 28 days and be reviewed. Among other things, these restrictions include a reduction of the limits on social gatherings, the prohibition of indoor food and drink in restaurants, bars, and other food establishments, and the closure of certain types of facilities, including gyms and fitness centers, casinos, bingo halls, other gaming establishments, cinemas, performing arts venues. So as we approach the 28-day mark since these restrictions came into effect, I have suggested to the province that we find a more balanced approach for the way forward. The approach I'm recommending is that we learn to coexist with COVID with care, and the goals of the response continue to be the same: to minimize hospitalizations and death, as well as societal disruption. So through September and earlier in October, we were seeing a significant rise in the number of people testing positive for COVID-19 in Ottawa, and hospitalizations were increasing. However, I'm pleased to share with you, based on more recent data, this rapid rise that was seen earlier in the fall has been stabilized. And it's important that each of us keep working hard to bring these levels lower still in order to avoid outbreaks and deaths, particularly in our most vulnerable settings, such as long-term care and retirement homes, shelters, and congregate settings. Lowering the local rates of COVID spread will also help us keep our school communities safer and avoid overwhelming our hospitals and healthcare sector as they are trying to catch up with important surgeries. Je suis heureuse de partager avec vous que, sur la base de données plus récentes, la hausse rapide observée au début de l'automne s'est stabilisée. Il est important que chacun d'entre nous continue à travailler fort pour faire baisser encore les niveaux afin d'éviter les épidémies et les décès, en particulier dans nos milieux les plus vulnérables comme les maisons de retraite et les foyers de soins de longue durée, les refuges et autres lieux de rassemblement. La réduction des taux de propagation au niveau local nous aidera également à garder nos communautés scolaires plus sécurisées et à éviter de surcharger nos hôpitaux et notre secteur de soins de santé. So the rate of people testing positive for COVID-19 and the viral load measured in our wastewater, it started to stabilize during the second half of October. And it suggests that the efforts of people of Ottawa to keep distanced from people outside their households, to wear masks, and also even wear masks outdoors when physical distancing isn't possible, to keep their hands clean, to stay home when they're sick, that's making a difference. The modified stage 2 closures reduced also the incidence of close contacts in those higher risk settings, and they supported declining levels of virus in the community. Going forward, the emphasis must remain on the important individuals doing their part with businesses reopening. So the rationale for continuing measures to limit COVID and COVID transmission, it includes that the percent of people testing positive for COVID-19 has not declined, and it's still sitting at 2.7%, with some areas of the city even having a higher percentage of people who get tested ending up with showing that they have COVID. The number of outbreaks remains high, and we are seeing hospitalizations and deaths. And the potential for rapid virus spread remains if we let our guard down and become complacent, given the ongoing widespread incidence of this virus across our community and the lack of any significant community immunity. That the rationale to adjust the measures to enable businesses to open or to ramp up their operations includes some signs that the majority of people in Ottawa are and will do their part to limit COVID transmission as they're asked when the situation is serious. The negative impacts on the health of the population from the unemployment that's resulting and the closure of businesses that's resulting from the pandemic. And people's needs to have supports that will help them live with COVID through the winter and for the foreseeable future, at a time when reported mental health challenges are high and there's no end in sight for the pandemic. I've looked at the levels of unemployment resulting from the COVID-19 pandemic response. I've looked at indicators of the mental health of our community and the challenges arising from a backlog in surgical and medical procedures. I'm concluding more needs to be done to enable people to return to more of their usual supports and services in their lives. Similar to how schools are able to be open with precautions in place, businesses should be able to be open with precautions in place. People should be able to learn to live with COVID with care. And so as the colder weather approaches and people start spending more time indoors, we are shifting our communication strategy. When people spend more time indoors, mask use becomes increasingly important. It's especially important for people to know how to wear their mask properly. So to that end, Ottawa Public Health has created a poster and a video to help residents continue to learn how to wear their mask effectively to reduce the spread of COVID-19. We'll be sharing these resources across our channels in the coming days, and we encourage you to share this content with your networks. Our hope is that socializing this content will help residents continue to develop good habits that will continue to maintain a good level of protection in our community, like how to properly put it on, remove it, where to store it, all of these things. Secondly, outdoor activities are good for both physical and mental health, and they're usually safer than indoor activities when it comes to COVID transmission. So So for this reason, Ottawa Public Health is developing and disseminating content to encourage residents to get outside, play and have fun over the winter months, as well as sharing information on how to do so more safely. Our hope is that encouraging people to partake in outdoor winter activities will not only promote better physical and mental health, but it will also help combat COVID fatigue. Les activités de plein air sont bonnes pour la santé physique et mentale et posent généralement moins de risques que les activités antérieures en termes de transmission de la COVID-19. C'est pourquoi Santé publique Ottawa élabore et diffuse des messages visant à encourager les résidents à sortir, à jouer et à s'amuser dehors pendant les mois d'hiver, ainsi que les informations sur les manières de le faire en toute sécurité. Nous espérons que le fait d'encourager les gens à participer à des activités hivernales en plein air favorise non seulement une meilleure santé physique et mentale, mais aidera également à combattre la fatigue liée à la COVID-19. So Ottawa Public Health, in collaboration with hospitals, just launched a COVID campaign called 1 Million Reasons. We all have our reasons to stop the spread, and we are 1 million people strong, and the actions of individuals do make a difference. So radio ads started on a dozen or so radio stations this morning. You might have already heard it. In addition, we've produced video versions of these radio ads, and they will launch tomorrow on social media. The team's working on more products in other languages in the coming weeks. I think the team would like to share this video with you. And Deanne, if you wanted to take that on and do that now, we are calling on all of us to work together to continue that care and to do our part for the reasons that make sense for us. We each have a reason to limit COVID transmission. So Deanne, do you want to share that?
To protect those in long-term care homes.
To keep kids in school. To support our essential workers.
To protect.
So in conclusion, I want the people of Ottawa to know that we can do this. We can learn to live with COVID, coexist with COVID with care and caution. And it really, the health of our population depends on it. So that concludes my verbal report, and I'm happy to take any questions.
Thank you, Dr. Etches. Excellent video. No, that's really striking, really striking. Well done.
Thanks, and to the hospitals, you might have noticed the hospitals were involved in financially supporting this project. So.
Yeah, no, it's great to see all the partners working together, and the product, as I say, is quite good. So it really hits you here, with each person's personal story. So I'll go through I'll go through the list in case anybody has any questions for Dr. Etches. Member Banham.
No questions here. That's a great video. I almost cried, so it was really good.
Member Cloutier.
Thank you, Chair Eglai, and thank you, Dr. Etches, for your presentation, and it's an outstanding video. I have just a couple of comments to support, and if you want to comment at the end. First of all, thank you very much for your communication on Halloween. That is a difficult needle to thread. Restaurants and bars is a very difficult situation, and in the communication, as you know, I've spoken with Eric. I certainly appreciate the communication and the Twitter threads from OPH, and the video that you've just shared with us is another example. Tonight, Dr. Etches, you used the words coexist with COVID, with care, or with caution. And you said that was a new approach. I think you've been saying that consistently. You said it months ago. I was looking at my notes, April 22nd at council. You said, we need to learn to live with the virus. It's going to be a long run, you had told us. And I appreciate that. And I appreciate, you mentioned, Dr. Etches, you're exchanging with the mayor and I imagine with the province of Ontario, with the Ministry of Health. And my point is this: I support you. We have to be careful with the data that we're looking at. The pie graph that was released by the province represents data from the known outbreak. The data is dependent on people who've provided their contact tracing information, and that's often in 4 active cases in our community. And there's been 7,100 cases in Ottawa. And we know that represents those who've gone to get tested, and it could be much higher in reality. Correct me if I'm wrong. So the thinking is, and I agree with you, we need to strike a balance between those public health measures, which I fully support, and the local economy. And mental health, you'd mentioned mental health. And so should the decision be made to, at the end of 28 days, to reopen up the gyms or the bars and the restaurants, there has to be restrictions on the number of people who can gather in the same place, physical distancing, and cinemas also. But I think it's important because it gives our residents an outlet to socialize in a healthy, safe way, but to be out. And we know winter's coming, and it's going to be a long winter. So I guess my question is, we've seen a decline in the number of daily cases overall. Sunday was a higher spike. Is that related to restaurants or bars, or is that related to the news and the information and messages from persons such as you, Dr. Etches, that we need to double down, we need to re-emphasize physical distancing, mask wearing? Do you think it's related to the restrictions of restaurants or bars, or is it the other measures? Is transmission in bars and restaurants a significant factor? And can or should they be opened up as an alternative to house parties? And I'm referring, of course, to that regulated versus unregulated environment. And I'm using regulated in the broadest possible terms.
You've given me a lot to respond to there, Councillor. I want to start with the observation where you started, that I have been saying we need to live with COVID for quite a while. I think what's happened though is that's been lost. The tone hasn't reinforced that. I think the tone has been a bit more what you can't do, right? And so it doesn't convey that we're living. It conveys that we're not living, we're not doing stuff. And I think we need to get back to living. And that's for the health of the population too. It just is I think some people mentioned they found the video very a little bit emotional, because we know of people who are hurting because of COVID, who've lost their business, or who somebody gave me an example today. Their grandchildren, a grandmother can't see her grandchildren because her cataracts are getting so bad, and she can't get cataract surgery, and she may not see her grandchildren again, before the end of her life, because the wait time's now so long. So there's lots of things. So I guess what I'm then going to your question suggesting is probably the closure of bars and restaurants helped, because it limited close contact, and that's where COVID transmission happens. But it wasn't the definitive thing, because the decline in COVID transmission started before the provincial restrictions started. And I do credit the people of Ottawa for doing their part, because ultimately that's what it comes down to. If people aren't coming within 2 meters of somebody else not wearing a mask, you won't get COVID transmission. So there's many factors. I'm not going to credit my messaging. We have many different factors that go into getting that message across, and people being informed and choosing that. But I do I do think it's a more feasible way forward to continue to encourage people and highlight and note that it can be done. We've done it. Let's keep going, and then provide lower risk options to private gatherings. And so that's where I'm coming to your second point, or third point maybe, about the harm reduction approach. That I do think we don't have a lot of data on this. We have to evaluate it. But I do think if venues are not open, and they're not open late enough too, then that drives people to socialize in inside environments where there's no physical distancing and people aren't wearing masks between groups. And so you know, this is something we're going to monitor. We're going to try to evaluate with things opening. Hopefully, then what does that do to the private gatherings and the risk there? So does that get at your questions?
Absolutely, absolutely. And again, I support and I support the work and the messaging that you've given us. And I guess in that context, and with full kudos to the communication team at OPH, I guess their next challenge is to find a communication campaign that encourages dialogue around safer gathering and social visits. That, you know, no, we won't come over for dinner, but we can meet in a park, and we can each bring coffee or takeout, and we can meet that way. Because, as you've said, we need to learn to coexist. And I know your emphasis of the word, we need to live with the virus, and to until we could find the ultimate solution of eradicating it from general transmission. So thank you for that. I have another question. Can I ask you a question, or just make a comment about flu shots? Because you said in your verbal, you mentioned verbal report flu shots. Does OPH release to pharmacies? And I'm simply asking because my family, those who are in the 3 persons who are in this household right now, we had made an appointment at the pharmacy, and we got an email yesterday that it was canceled because of supply, and we've heard about that. Does the supply for pharmacies come from OPH, or do they get it directly from the province?
Pharmacies get their influenza vaccine supply directly from the province.
From the province, okay. So in a context where that is occurring, and we've heard other persons where that is occurring, I guess there will be more pressure on OPH vaccine supplies. So I'm just bringing that to your and your colleagues' attentions that it's going to be a busy season.
Yes, we're feeling that, and we're up to the challenge, and we have a supply for our own clinics for the foreseeable future.
So, thank you, Dr. Etches, and thank you, Chair.
You're welcome, and don't forget to make another appointment, Sean. Vice Chair, please. Any questions?
A question the flu shots, actually, and then back to COVID as well. For the flu shots, we're hearing from family physicians in the community. I mean, it's reported widely in the media. Some family physicians seem to have a strong supply of flu shots, and others seem to maybe not have enough, or not have the supply they were expecting. What's the scoop on that?
We've informed family physicians, like we do every year, that our distribution out to them will depend on what we receive from the province, and it will be done in batches. And we ask them not to schedule any large influenza immunization clinics until November. And we're just November now, because it's a limited supply we get from the province, just like the pharmacies. It comes in batches, and the first batches we need to get to hospitals, to long-term care homes. And we did in the first batch send some vaccine to all physicians who asked for it, but we did not give them 2,000 each. We might have even given them 100, but enough to get through the first week or so of their patients. And that is then they're able to reorder, and we are filling second orders. I think we're on to filling third orders. But if they're asking for 2,000, we may not be able to fill that right away. So we usually phone the physician's office and talk to them about what their plans are, what they need, and we're working with them. Our goal, as soon as we receive vaccine from the ministry, is to be able to turn it around within 2 days out into the community physicians' offices.
So it probably represents the increased demand that they're hearing from their patients too, which is ultimately a good thing.
Which is good.
Yeah.
And so, I would just encourage members of the public who are maybe encountering pharmacies or physicians who don't have the same level of supply that meets the demand right now to continue, that there will be vaccine that continues to come. So continue to book appointments.
Good, thank you.
The flu season hasn't started in Ottawa yet, so there's time.
Thank goodness. And so I guess just to go back to COVID for a second, I too would echo Councillor Cloutier's positively around learning to live, and that whole stream around coexisting with COVID, I think is great. I was remarking about, Halloween, tough message. I think you did a fantastic job in the media, Vera. And what has come out this week is that, the talk around the work is the memories that were created in a different way for Halloween. And I think it does represent that living, right? And so, Halloween's come and go, and everybody does remember trick-or-treating, but they'll remember this in a different way because we did different things and created different memories, which I think is part of coexisting with COVID, and to your point is living with it. So I think that was great. I also like the line around the blind spots. That was, I think, on social media last week as well, around, and we see this in healthcare where, we're all getting very good at PPE with patients and, all of the universal masking and the precautions. Where we do tend to let down our guard is when we're having coffee with our colleagues in the break room. And that's where we've seen transmission happen. So that's a healthcare example, but equally as relevant if you're, with neighbors or friends and, thinking that they're doing their part, and they probably are, but to really not be letting down our guard. So I thought that was great to be highlighting that as well. So good job. No further questions for me.
Thank you, Vice Chair. Member El Santiri.
Thank you, Mr. Chair, and thank you, Dr. Atchis, for everything and every day what you do. Seriously. Michael, as just for transparency, I do co-chair the Mayor's Economic Development on Recovery. And I do have, obviously, the contact with the Ottawa Coalition of Small Business, BAAs in the city. And regardless of the information, I think as a council, we had asked the province for the data to tell us so we can learn from that data. Unfortunately, we did not receive any data. I know they're saying it's 2% from small businesses, bars, restaurants, but there's other unknownly from a gathering. What about if they were from a private party? What about if they are from Airbnb, as we heard some young people is doing it? So that's been said. We didn't receive the data. Moving forward, what can we do? Because you mentioned more than once in your report tonight, to learn to live with it. So what can we do to help the small businesses to avoid a major shutdown? What can we do to help them to isolate that problem and work together with them? Because we know our community, and I have to give credit to all the businesses, gyms, bar, and other, they did they followed the rule, they did their fair share, and now Friday is the end of 28 days, and I'm sure province they're going to make some announcement. What's your advice to me and to all the people? What can they do to create that separation so we don't have massive close down or shut down?
The businesses are very interested in taking precautions as they open. And, I think that we want to have an understanding and appreciation for all that they're doing. And that means that we need to do our part as residents and as patrons. And it isn't different from the usual advice. It means that we need to stay home when we're sick. Don't go out when you're not feeling well. It means, keep your hands clean. Don't touch your face. All those things with spreading COVID that way. It also means that you should wear a mask as much as possible when you're indoors. And in restaurants and bars, you take it off to eat, but you should put a mask on if you're not eating and drinking and you're talking to a server, right? So the default should be wearing a mask always when you're indoors, and then take it off when you're eating and drinking, because you have to, right? That's part. But just the more we protect the servers, the others in those environments, it's simple physics, right? We just decrease the opportunity for the virus to be spreading. The team here at Ottawa Public Health has been working with businesses and business associations to create a little bit of a campaign about being COVID-wise together. And so we are going to be sort of strengthening the visibility of that. It was launched but then shelved because businesses were closed. I'm going to bring that back, and it's to tell the stories about local businesses that are doing their part to protect patrons and to encourage people to do their part. So it's a couple of videos, it's some messaging about COVID-wise together, us residents, business owners, and I think that's one of the ways forward, is to show that it really makes a difference in our community to be able to have access to services and to be able to keep people employed.
My other question is, and I hear it quite often from the business community, their staff and other. So we've seen increase in alcoholism. We've seen increase based on police record with they stop more impaired drivers. We've seen increased use of, and you said that to us way back in the spring, there was increase in so the mental health obviously is taking a toll on residents. And yes, we hear announcement, there's support for the businesses, there's support for the individual, and quite honestly, that support, which is someone like me who is quite involved, we have not seen since the day the announcement was made. And that concerned me, because we've been asked to do our share or our part, and they do it so well, but then the other part is not been. And it seems some decision is really, it's kind of hard for me to explain it. So they said no dance studio, but then they opened them, but they didn't open the gym. Okay, why you're allowed 10 people in one room as a dancing, but you don't allow 10 people in 9,000 square foot gym? So some of the, and I'm not saying this is Ottawa Public Health, I'm just saying we need you to send the province a message. We want to work with them. We want to support their decision. But at the same time, let's remove the politics out of this. And when they say we have supported the small businesses, make it available, make it easy to access this funding.
Yes, I think that the financial support, those policies that are federal government as well as provincial government policies, it does seem to be taking some time for those supports to flow. And I know we've heard as well that the level of distress in the community is high. People can't make it through financially without that support. So, that again, I'm in favor of opening with caution because that's the best way to try to get revenue back. And we need to have confidence in the public to go, that businesses are being cautious. And if we each do our part, we can get back to living. I think the alcohol consumption that you mentioned is a concern. It's something our team is looking at with our partners in the mental health and substance use community, and part of the overall strategy. Again, if people are drinking because of stress levels, we need to get at the underlying source of the stress, and we saw that with schools. Parents reported high levels of distress when schools opened and daycares opened. That decreased. And so, it's making sure that we can get back to some of the supports that we need, and make sure people know that the services exist when they need them. There are supports same day or next day for counseling, online, on the phone. There are help. There are sources of help available.
Well, thank you very much to you and to your team, Dr. Ashes. We can't say thank you enough to our staff for every day. One of the messaging I would like to see, as a city, sometimes we have a report and would say it will have no financial impact or no impact on the rural area, or no. Maybe some of the reporters from the public health should touch on the mental health impact and how, if you are impacted, how you're going to receive help. And we're always just to remind us about that phone number. Just tell the community, because I have to tell you that we have 62 small businesses in the city. Within 8 hours, they were all shut down and went home, and to that day with no financial support. It's got to be something we can at least identify. If it's going to happen, if you need help, if you need someone to talk to, this is the stress line. So if we always, with our media relation, to always remind people there is a help and there's mental health support if you need it. Thank you.
Thank you. Member Gower.
Thank you, Chair. Thank you, Dr. Etches, for the update, and thanks to your team for all your continued work. There's two topics I wanted to ask about. First was the communications. I do like the new approach. I think we've seen through this pandemic that alongside things like wearing a mask and contact tracing and testing, that communications is one of the most important things in our toolbox to make a difference. I was wondering if you could give us a sense of what does your team look like now for communications? Is this all being done in-house? Are you working with partners? Do you have enough people on your team for communications? And how is that changing? How do you see that changing, I guess? Because we're the Board of Health, and I think as we're entering a budget period, it's important to know, are you resourced properly?
Well, I can tell you that the team's working very hard, and we've had to add to the team. But we can always use more help, for sure. There are things we want to do more with segmentation of the audience, right? We want to have messaging for older adults, for people in their 20s, for parents. We could keep going. There's endless the kind of communications we could do that are more targeted, and we will continue to work that way. But we are doing most of this in-house. So we have a videographer who's outstanding, and hasn't been with us that long, just over a year, I believe, but it's made a big difference. We have people who focus on social media, people who do media relations. The number of media inquiries, I think it's 3 times what you would usually do in a year, we did in 6 to 7 months. The volume of work is huge. And then, everything we produce has to be translated into, or not translated, like, I don't mean the language adapted into French or other languages, but all the guidance, the communications team looks at it to make sure that it's clear. And so they're involved in all aspects of the response. And well, we're going to talk about the budget. It's bigger than usual. And part of that is communications people. Now, when we don't have, people on our team who have a particular skill set, then we will outsource. And some of the outsourcing we have done is more getting some focus group data together to inform some of our work. Sometimes there are other parties who are better at, for instance, collecting information through focus groups to inform our products, but almost all of it is in-house. Small but mighty.
That's helpful because I know we see the daily logs of media requests, and I know the amount of email requests that we get in our office that are forwarded to your team. And just, I think out of every council meeting we ask you for more help in communicating to businesses or residents. So yeah, I'm just curious how the volume is. The other thing around communications is consistency in communications. And I'm thinking among different levels of government. And I know that you are always in very close touch with your colleagues across the province in public health. Is this kind of a shift in messaging? Is it something that's coordinated with other areas in Ontario? Or, I mean, I'm trying to get a sense of, I think you're on the right track. My concern is that we've sometimes seen some very different messaging. I mean, think of Halloween, for example, how there were some different different directions coming from different levels of government. So what confidence do you have, I guess, that we'll see the same shift of approach or the same support for what you're trying to convey?
Well, I have spoken to the province as we near the end of the 28 days and restrictions, and part of my recommendations to the province related to how we communicate. So we've had some initial discussions about the communications, and we'll continue that. I think that there'll be ongoing dialogue about how we're communicating through this period.
Okay, and I just wanted to quickly ask about mental health. You mentioned you've been evaluating indicators of mental health in the community. What kind of signals are you watching? How do you monitor overall community mental health right now?
Just recently, I think we're just about to be able to analyze the latest round of mental health related data taken from October, and then we well, those are our two main sources of data. But Amira, yep, please go ahead. Yeah.
Yeah. So you've hi, good evening. So yes, what Vera, Dr. H has mentioned is that we have a societal impact survey that we're on the third wave. The survey closed last week, and we're in the process of analyzing it. So we will be reporting on mental health, stress, anxiety levels by different groups. Families with children, as well as youth, and we also are reaching out to some of our partners to talk about mental health services utilization to try and get at that. We've also asked some behavioral questions in the survey that we will be reporting on that shortly as well. We also asked income and in the survey as well, ability to access services. And we're also going to be looking at the Statistics Canada's income over the last 3 months to compare between June and now. So those would be some of the variables that we're asking, indicators that we're asking about.
Okay, thank you very much.
Is that it then, Member Gower?
Yes.
For questions? Okay, thank you. Member Kavanaugh.
Thank you very much, and thank you, Dr. Etches, for your presentation. It doesn't stop. OPH has so much to do, and COVID is just one aspect of it, obviously a very big one, but we still have so much to do, and with the flu shots, etc., coming up. I wanted to thank OPH for the collaboration, hopefully, on promoting outdoor recreational activities. I think that's really, really important. As you know, Councillor Brockington and I had a motion, and I think it's really important because it's reaching a broad section of people, as you were talking about the different groups that are out there, and you're trying to communicate to certain groups, the youth, you're trying to families and seniors, and but the commonality is everybody still needs to get out and keep active somewhat, whatever level is appropriate for them. So I just wanted to know, will that be something, for example, you were talking about cooperation with the province. Is that something we can get the province to buy into as well and spread that message even more? And what kind of communications can we expect?
I think, again, I don't have the details of all the different products that will be used to promote being active outdoors, but I think in my verbal update, I mentioned a couple of things that were underway that we'll share, like sort of shareable pieces you can push out in newsletters or updates on social media or other formats. And I can certainly underline that for the province as well.
That would be great. And particularly for the vulnerable populations, I appreciate hearing about the work on mental health, and that's part of coexisting with COVID is the concerns about mental health. It's not just we're obviously reminding people about how to stay safe physically, but what are we saying about staying healthy mentally?
Yes, so again, I'll invite Esther maybe to describe a little bit more of all the things we're doing to promote mental health right now. We have it as a focus in our schools work as well. So, we have nurses who have been supported to be in schools to help address the COVID situation, but they are also finding that the schools and families are asking for information about how to promote mental health and access resources if needed. So that schools work is certainly an important channel and venue, and we can reach families through students as well. But Esther, did you want to elaborate on the other work? I mean, you heard from the chair, we're continuing with the community action plan on mental health and substance use. That includes a lot of work on stigma to try to make sure, again, people who need to access help are doing so. The African, Caribbean, Black community and mental health is a priority. You remember our report on that. That's being turned into actions, that a framework to promote mental health of the Black community, along with the communities, is working on what that looks like. What are those actions? And there's many different elements. We're concerned about caregivers, actually, has come to the fore more recently as parents, older parents, and people are squished and trying to care without all the supports they normally would have. And so sometimes we're concerned that people start to feel hopeless and that there isn't help, and there is help, and we need to make sure people get connected to help when they need it. And so some of this suicide prevention work is also a priority, and that is work we're doing with communities who may be at higher risk through third parties. We're expanding our suicide prevention training. So here I've gone on and spoken about some things, but if Esther is really leading that work. Sorry, Esther, is there anything you want to add?
Thank you, Dr. Etches, and through you, Chair. I think Dr. Etches has done a marvelous summary. The only thing that I'd add is developing some virtual supports for elementary and high school students that's underway, in partnership with CHIO on resilience and coping with stress, and where supports can be accessed. Dr. Etches mentioned the suicide prevention work and crisis intervention training. We are going to be starting by working with over 200 community leaders who really do support some of our most vulnerable residents who are isolated and are at greater risk, starting with our Ottawa community housing, tenant leaders, and our faith leaders. That's, I think, going to be our first step. Thank you.
Thank you. No, I appreciate that. And I appreciate the outreach you've been making with your staff to talk to us as counselors about what's going on in our community. I was able to pass on information about particular concerns of youth in social housing who are university age, that group that's just beyond high school that gets forgotten. So I really appreciated having an outlet to talk about what's going on in those communities. We're getting that firsthand experience and learning from it. So that is really helpful. And I appreciate the ongoing commitment on that. Thank you.
Thank you, Member Lakin.
Thank you, Chair. Thank you, Dr. Etches. Just a couple of quick questions and a brief comment. First of all, thanks for the sharing that video. Like others have mentioned, I really found it to be consistent with the ethos and the message that Dr. Etches has been sending all along, which is a very positive and motivating message for the community to do their part. And I think it really speaks to that, so it's nicely done. With your comment, Dr. Etches, about being encouraged by what looks like a stabilizing of the spread, and some of the numbers that we get to see on the dashboard daily, can you help me reconcile those and what the lag is between those big daily numbers? Where did those come from? How long ago did those come into being? Just to help me get a sense of balancing, encouraging, and yet some record-breaking numbers at the same time.
There we go. So when we get a report, like the most obvious number, every day people seem to want to report how many people tested positive that was reported that day. That number that's reported that day, it includes the results we got that day. They could be results that were taken from a swab 5 days ago or yesterday, given the situation in the lab. Sometimes 5 days, hopefully not anymore. We are getting the majority of our test results now within 2 days from when the swab is taken. But then you go back further because maybe that person presented 3 days after they started to have symptoms, or maybe 7 days or 1 day, right? So there's a delay there. And then when you think about the incubation period of the virus, it's up to 2 weeks. So the exposures that happened that caused the numbers that we see each day could have been 3 weeks ago. And so there's, it's probably more likely to. The numbers all in one day, again, they can be lumped together. It depends. Somebody mentioned the spike on Sunday. That comes from, unfortunately, a difficult situation in a long-term care home where many people have dementia and they are wandering, and it's very hard to control COVID in that kind of environment. So sometimes we see spikes that come from one outbreak. But overall, the trend has been improving for a number of weeks, and that's in the cases of people who test positive. The hospitalizations also have stabilized for a couple of weeks now. The outbreaks have actually been declining for a week in schools and in other settings. Those have an even greater lag. That the hospitalizations, outbreaks, those, again, it can take even longer until we see the hospitalizations go up because people have to get more seriously ill. The wastewater, I haven't mentioned yet tonight, which surprising because it's one of my favorite indicators. It is more real time. And so when we look at the wastewater, we are seeing continued encouraging signs that the real-time measure of the virus in the wastewater is dropping. So does that answer your question?
Yeah,
about?
it does. Great. No, very helpful. Thank you. And so the message is that the majority of the community really is doing their part.
Yes.
That trend, the positivity rate, and your other indicators are trending in the right direction. And so, you'll forgive me for belaboring this point, when the news occurs that there may be segments of the community that aren't doing their part, is there any guidance for the rest of us in offering in how to understand that, and whether it's troubling, but is it impacting that trend in a way that we should be concerned about?
I do think, ideally it takes 1 million of us because we see how one person testing positive and they don't realize it can lead to hundreds of contacts very quickly if we're not limiting our close contacts. But if all of us are trying to limit our close contacts, you won't get that rapid spread. So it is something we want to try to change the social norm, help people understand you're with the majority, continue to do your part, find your reason, what's the reason for you? It is important that there can be these super spreader events, that can set us back.
Thanks for that. Thanks for everything.
Thank you, Member Menard.
Thanks very much, Chair. Thanks very much, Dr. Etches, and to your whole team. I don't have other questions. I just wanted to say thank you so much and really appreciate the new messaging. It makes a lot of sense to stay positive and not fear-based. And I don't think we've been fear-based ever. And you've been positive in your messaging about change that's needed in behavior. And so, really appreciated that approach. So that's it for me, Chair. Thanks.
Thank you. Member Pinnell.
Question, but I want to thank you, Dr. Etches, and your whole team. The 1 million reason video is really special and really universal, so people will listen and it's going to be shared. And I'm going to add another comment. Your beautiful little video on Halloween, the little bird, it was amazing. I'd like to, and it shows it was amazing because it was shared like millions and millions and millions of times. You deserved an award for your
it's not me. Yeah, it's not me. I'll pass that on to the team again. Yeah.
But for your performance also, you believed in it, and it was, no, I don't want to say acting because you believe in it, you lived it. So thank you. Thanks.
I feel like I should be saying in the envelope, please.
You got it.
And last but not least, Member Tilley.
No, just echoing the others' remarks, Dr. Etches. One quick question, and probably I missed it. Is the video solely being shown on social media?
I'm sorry, I'm not aware of the full dissemination plan.
Okay.
But did you have an idea?
Well, there's, this is a pandemic virus that's affecting the older demographic, and certainly we've seen when we try and reach out to different demographics, social media hits a younger to a mid range, whereas the older demographics still stick to the traditional media resources, although those are costly sometimes.
Actually, this is why this is actually different. This one is radio.
Oh, so it's solely radio?
No, you saw the video today.
Yeah.
We'll send out, but it's actually radio because we do know that older adults listen to radio.
Yes, absolutely.
And radio we can use across many different channels, different shin, to reach different audiences. And so it, again, thanks to the hospitals. I really want to thank them for I believe they worked through their foundations because they saw the value of preventing COVID for their systems to function properly, and they invested so that we can, I think it's across multiple radio stations for a period of time.
Now it's a good video. Have you thought of going with the video piece as well too for social media or other extensions?
Yes.
Okay. And the other thing I was going to say, it's great. I just love this approach of learning to coexist with COVID with care, because I'm starting to sense that if we don't do something like that or start with that messaging, certainly we're going to see a general fatigue amongst our population that's just going to lead to indifference, and that's when the problems are going to start. So I think it's a great approach. So congratulations on that.
Thank you. Member Banham, I understand that you have another question you'd like to ask, so please go ahead.
It's the challenge of always going first. I get to hear what everybody else has to say, and then I'm like, oh, I really wanted to say something on that. I just wanted to go back to the mental health piece. And Ottawa Public Health retweeted me this week on this piece, but they're finding that people who've given birth or are in the perinatal period up to 1 year postpartum typically have is mental health at about 20%, but new research out of Alberta is showing that that is increasing because of COVID to up to 40%. And often we hear a lot talking about mental health. I think I've said it before about addictions in children, and all of those people are also important. But we do have a bit of a crisis when it comes to women's mental health and the access that women have to mental health supports. Women's mental health at the Royal is completely funded through donations. There's no government funding for women's mental health specifically in Ottawa. So I just want to talk specifically about that piece, women's mental health in general, viewing women as people who need specific support and help to access mental health. They often put a lot of people, this is generalizations, they often put a lot of people ahead of themselves. And often by the time they actually go for support, they're in more of a crisis mode. And that's specifically true for new parents, new moms specifically. Right before I went on maternity leave, the Ottawa Birth and Wellness Centre in partnership with the Royal started a perinatal mental health group. And part of that, it's not self-promotion, part of that was doing evaluation of the different supports that exist in Ottawa from a multitude of different organizations that help. So that will be coming out, and hopefully that will be shared with Ottawa Public Health so that we can understand better what supports actually are out there, because it was surprising. And then the last piece of that is that part of it is around peer support. So our group is facilitated by social workers from the Royal, but it's a peer support group. And there are people who train peer support facilitators in Ottawa. I know psychiatric survivors train peer support. So perhaps we're finding that using Zoom is working in a peer support model. People are getting value from peer support, and it is, I believe, a lower cost way of delivering support, especially for groups that need that kind of mild to moderate support. So I encourage whether it's Ottawa Public Health looking more into peer support or helping our partners kind of come together. I think it's an important part to focus on.
Yes, so you may recall we talked about parenting support that would be peer-to-peer. That was actually, we expected to see progress on that in 2020. I can't believe it's November. And unfortunately, we haven't launched that program due to COVID, but we are seeing the need for it. I would agree with you. And so we're looking to partners to help advance things where we may have less capacity right now. So the Ottawa Child and Youth Initiative is also taking a look at this idea of how we can be a village and the village that it takes to raise a child and support each other. I think that also, you know, this does link to maybe some comments I'll make related to the budget, Lou, in that we aren't able to continue to not grow the essential public health services like support to parents, postpartum. We need to get back to doing more and more of that. So that is the intention.
Well, thank you very much, everyone. Can we receive the Medical Officer of the Health Verbal Report? Thank you. We're going to move to item number 3 now, which is the 2021 draft operating budget. And we're going to go at it in a series of steps. I'm going to make some opening remarks, then turn it over to Dr. Etches. And then Lou Valoria is going to speak to a PowerPoint presentation. And then we will take questions. Questions at this point are high level only. Remember, we're not voting on the budget per se tonight. we're voting on a number of different recommendations, and the first one will be to receive and table the 2021 operating budget, and the second will be direct staff to forward the draft operating budget to the City Council for the tabling of the overall city budget. And then we will deal with the budget and its particulars, if you will, in much more detail at our next meeting. So as we table the draft 2021 operating budget rather for Ottawa Public Health, I'm mindful of everything that has happened this year. We started 2020 focused on public health modernization. And I think back to the meeting that the Vice Chair and I took, and we were very excited. It was a good meeting with Renfrew, and we thought, you know, we're on to something here, and then boom, along came COVID. So we haven't really been having that discussion, but that's how 2020 started. And we were thinking about ways to deal with a 5% shift in the provincial municipal funding formula. In fact, we made our final submission on modernization to the Ministry of Health on March 11th. And it's hard to believe that just a few days later, on March the 15th, Dr. Etches was recommending that Ottawa residents stay home as much as possible due to local community transmission of COVID-19. Since then, COVID-19 has dominated our discussions, both at Board of Health meetings and at City Council, many days at my dinner table. It's been all hands on deck as Ottawa Health and City of Ottawa, and indeed the entire community have come together to respond to the pandemic. I know that every single OPH employee has worked tirelessly this year, not the least of which Dr. Etches and her senior leadership team. And I would be remiss if I didn't take this opportunity to thank them for their dedication and their commitment to keeping Ottawa residents as safe and healthy as possible as we navigate this challenge. I think that you'll see reflected in this draft budget is a public health unit stretched to its limits, a city administration doing all that it can to support our local health unit, and a provincial government committed to funding COVID-related costs to get us to the other side of this. We know that over the past several months, OPH has had to prioritize the COVID response over essential public health services, and that the reduction in these prevention programs has disproportionately affected some of our most vulnerable citizens. On October the 14th, City Council unanimously approved a motion calling on the Mayor and I to work together to advocate for the province to provide additional funding to OPH to support core public health programs and services impacted by COVID-19, by the COVID-19 response rather. This work is ongoing and we are hopeful for a positive outcome. With that, I will now turn over to Dr. Etches and to Lou Favoria, our Manager of Performance and Corporate Services. And I'll ask Dr. Etches to make her opening remarks, please.
Thank you, Chair. I would just like
to sorry, Dr. Etches, and if you check your in baskets, the Board Secretary has just sent me a message to say that the budget documents should now all be in your inboxes. Sorry, Dr. Etches.
No, that's great. I thought I was on mute again. I would like to say a few words before I turn it over to Lou to present the budget. And as the Chair mentioned, we're in a global pandemic. It's unprecedented. And so as a local health unit, we've just had to do everything we can to respond. And you know, this has created pressure on our resources, our human resources, our technology resources, and our financial resources. So I am very grateful to the support we've received and we continue to receive from the City of Ottawa. The city's helped in a lot of ways, including right now, backstopping Ottawa Public Health's expenditure levels, which are required to continue the response to the COVID-19 pandemic as we await the provincial funding. We know that in usual times, adequately funding public health programs and services provides a significant return on investment in terms of the long-term savings to health services, social services, and the criminal justice system. As for the value of funding the pandemic response by public health, we know the economy cannot recover if the virus is winning and we can't control the virus. Therefore, ensuring residents have the information they need to protect themselves providing sufficient resources for the testing, case and contact management, and contact tracing. That's essential if we want to be able to keep illness at bay and get our economy, recovering, into the future. We talk about until a vaccine arrives, but we are needing to manage this virus for a long time. So I have confidence the province understands this value of investing in public health and that they will ultimately provide the support that's needed to sustain our operations. Lou, I'll leave it to you to describe what we're putting forward. Thank you.
Thank you, Vera. I'll just wait till the presentation's up. So next slide, please. One more. There we go. Thanks. Tonight, as we table the 2021 budget, we'll cover budget highlights and assumptions, provide a brief overview of our programs and funding sources, discuss our estimated requirements to continue to address the COVID-19 response, provide an overview of the 2021 budget changes, and finally, the budget timelines. This draft budget reflects best estimates to continue to respond to the pandemic while limiting impacts on the health and well-being of Ottawa residents. OPH will continue to work with local and provincial partners to identify areas to strengthen the impact of resources invested in the public health system across the province. Next slide, please. We're presenting a balanced budget of $98.1 million, which is broken down between $74.1 million of base funding and $24 million of one-time funded requests. It incorporates an inflationary growth base increase of $1.16 million from the City of Ottawa. It assumes a 0% provincial base increase from the Ministry of Health, assumes all one-time requirements will be required for the entire year and are provincially funded at 100%. And lastly, does not include provisions for activities related to providing a COVID-19 vaccine to the public. Such budget impacts are currently unknown. A full costing and description of required activities to administer a new vaccine will be provided to the Board of Health once the provincial immunization plans are made known. Next slide, please. Funding for public health services consists of several categories. Cost-shared funds are used to deliver programs to adhere to the Ontario Public Health Standards as they relate to the Health Protection and Promotion Act, and they represent the majority of the Ottawa public health budget. Since the pandemic began in March, OPH has had to divert approximately 80% of its staff away from what was planned at the beginning of the year to support the COVID-19 response. The Chief Medical Officer of Health directed all health units to take all necessary measures to respond to the COVID-19 while continuing to maintain critical public health programs and services identified in their pandemic plans. OPH has done this and continues to monitor and adjust resources as required. Recently, OPH took action to reinstate critical services in infectious disease, healthy growth and development, mental health and substance use, dental treatment, and immunization services to lower levels of risk for the priority populations. The next largest envelope is 100% provincially funded programs, which include Healthy Babies, Healthy Children, the Ontario Seniors Dental Care Program, Indigenous Health, and harm reduction. Resources in this area as well have been redeployed for the response with the support of the province. The last category, which is 100% city funded, includes adult dental expenses, which are mostly recovered from Community and Social Services Department within the city, and other programs such as mental health, substance use and injury prevention, and school-based outreach. The next slide, this next slide lists the programs that were required to be augmented over and above the base cost shared and 100% funded programs in 2020 and required to be continued for 2021 in order to respond to the pandemic. The areas include case and contact management, which meets ministry and federal guidelines to follow up with residents that test positive for COVID-19 and their close contacts within specified timelines and compile and submit reports to Public Health Ontario. School support, which work with local school boards to implement provincial standards and guidelines. Areas of focus include providing infection prevention and control advice, supporting testing and surveillance, delivering mental wellness support, and facilitating knowledge exchange with stakeholders and the school community. Infection prevention control, which monitors and responds to any resident or healthcare worker that tests positive for COVID-19 in institutions such as long-term care facilities, childcare facilities, and congregate settings. Communications, community engagements, and operations, which manage all communications with various external and internal stakeholders, as well as provide support to the community partners with information, resources, and guidance. Messaging to all stakeholders must be continuously adapted as the pandemic requirements and response changes. Cultural adaptation is also a priority, which includes work with community leaders and organizations who can help build supports for populations at higher risk of harms from COVID-19 and other challenges to health. The next group is surveillance and medical support. They analyze, interpret COVID information, outbreaks, clusters, and societal impacts data. They provide ongoing reporting and technical guidance for case and outbreak investigations, specific settings, and practices. Emergency response phone line responds to all COVID-related calls and emails from the general public, schools, childcare centers, workplaces, and healthcare providers. And finally, logistics, information, technology, finance, and staffing support provide support services to the whole organization, such as digital application solutions, hardware support, procurement, asset tracking, and staff scheduling. Moving to the next slide, it provides a high-level summary of the 2021 budget expenditure changes. In order to maintain existing services, the budget includes a provision of $1.14 million for the future negotiation of contract agreements and $20,000 for inflationary facility costs. These base pressures are funded fully by the City of Ottawa. Next is a list of one-time pressures for areas that I referenced in the previous slide, and they amount to $22.5 million. As stated earlier, it is assumed that these specific pressures will be provincially funded at 100%. Slide 7 provides a high-level overview of the 2021 budgeted revenue changes. Of note, and with respect to COVID, the province has confirmed funding for 45 school nurses to the end of July. The $1.5 million indicated represents the adjustment required to bring the funding amount up to the 2021 approval. All remaining COVID funding is expected to be announced in 2021. In summary, the combined budget increase from base and one-time requirements amount to $23.7 million. The next slide represents the budget approval timeline. After tonight's meeting, the Board of Health budget will be tabled with City Council on November the 4th, and then returned to the Board of Health on November 30th for public delegations and approval. Next slide shows public feedback occurs from this point forward to the November 30th meeting and will be received in different channels. It should be noted that client and external stakeholder input has been obtained throughout the year and continues to inform the budget process. Next slide. Inquiries can be directed to Deanne Blais. So in summary, we're presenting a budget that includes provisions to maintain the base, considers the latest information when forecasting COVID needs, and assumes that we will be responding to the pandemic for the duration of 2021. So prior to questions, I just wanted to say, I want to acknowledge people in my group who've helped me quite a bit to get to this point, in particular Samantha Gosson and Victoria Cowell for their countless hours of behind the scenes work, and I really appreciate their efforts, as well with as a lot of other people within the department to get us to this point tonight. I welcome any questions.
Thank you, Lou, and thank you, Dr. Etches, and I want to say thanks as well, because this budget has been a real moving target, and we talked about it last council meeting, and that led to a whole series of discussions and meetings with the mayor and his staff, and the treasurer's office, and I do feel for Lou and his team, because it was almost daily. Lou, can you tweak this? Can you change that? Can you add this? Can you do this? They rose to the challenge each and every time. So I want to thank you, Lou, for that, and everybody else in your department, and Dr. Etches and your senior management team that also were a big part of that. Before we go to questions, I haven't got the message yet, but I'm sure we'll get it shortly from DS saying we're likely to going to go past 7, so we need a motion to do that. So, Member Tilley, do you have that motion with you, and could you read it out, please?
Yes, let me read the right one first of all. Be it resolved that the Board of Health approve that the meeting time be extended past 7 p.m. pursuant to subsection 8(1)(c) of the procedural bylaw.
Thank you, Member Tilley. Carried.
Carried.
Okay. Now we're going to go to questions, but there were a few comments on the chat when we were going through them, so I think we're going to mix it up a little bit. I didn't tell Deanne we're going to do this, but we'll do it in reverse order this time. So that gives Member Banham a long time to think about all the questions, but also gives some of the people who have had to wait in the past. Member Tilley, we'll go right to you, see if you have any questions or comments.
Just a great job on the budget. I see it's somewhat bold given the pandemic times. My question, I guess, being that we're depending on some of the provincial funding for 2021, whether Dr. Etches is, how confident are we, have we had any initial indicators from the province of their intention to support this additional funding given the pandemic crisis? And of course, subsequently, if we haven't, you'd dread to think, could there even be a contingency plan? Because obviously this is all very necessary to continue on with the direction to be going that you've highlighted.
Yes, I do have confidence that the province will do its part to support us with the spending that we are doing to work on containing COVID in our community. They have set aside funding for public health units specifically, and we've given them the forecast of what we expect to spend in 2020, and they have indicated, that is quite likely, something that that they've planned for covering. 2021 is they'll get our budget and they'll be looking at them all together. But I think that so far, we have been given the direction to respond and to keep track of our costs, and that they will cover extraordinary expenses.
And if I can add as well, Member Tilley, this is part of the discussion that we had at council last meeting, and we've had some very good dialogue with the mayor's office, and the city is very supportive of our approach, and knows the work needs to be done, and again, we've had some good discussions, and the mayor has certainly offered to have discussions at a provincial level as well. On behalf with myself, on behalf of public health. So I liked your term bold in terms of, but these are hopefully once in a lifetime situations, and we have to rise to that occasion and respond to it as is appropriate. So I hope that helps to answer your questions.
Yes, indeed. I hope it's bold enough.
Well, again, and I think Lou spoke to that a little bit. You know, there's some factors in 2021 that we don't know yet, right? We don't know about vaccinations and when that might become available, and if it does, how it's to be rolled. So that's apart from what you see in front of you right now. To take that into account should it happen.
If I may, Chair, so I also to say that if we don't require this level of revenue to support a COVID, we won't be spending it. So that's the other direction things could go in.
Wouldn't that be wonderful if we didn't have to do that and we had a less bold budget and a less once in a lifetime situation. Member Pennell.
Thank you, Chair. Thanks to Lou and his team for the preparation and presentation of the budget. And regarding my question, I guess it was along the same line as what Peter asked. So Dr. Etches and you, Chair Eagle-Eye, have answered the answers you could give. Thank you so very much. That's it.
Merci. Oh, you're on mute, Chair.
You know, eventually I will figure that out. Member Lakin.
No questions from me, Chair. Thank you.
Thank you. Member Kavanaugh.
Thank you, Chair. I just had a question. What was the city's contribution last year? If it's 1.16 this year, million. I'm just curious of what a difference it was.
It's a significant increase this year. I'll just get Lou to comment on that.
Fortunately, I don't have the number right off the top of my head. I believe that it was in the 750 range from last year. So it did definitely go up from last year. It was a significant increase.
Yes, that's what I thought. And I was going to try and look it up really quickly, but you did the reverse. It came up earlier than I thought. No, thank you. So that's fairly significant of the city. And of course, you're assuming no increase proportionate from the province. Is there even a slight hope that they could give kind of inflationary increase at all? Is there any possibility?
I don't believe we'd expect that based on their indications for 2020 and taking the same approach for 2020, 2021. That's why we've assumed 0% increase for 2021.
Yeah. No, I know you put that in because you have to. You can't, and we know that it's been going on for years that way because there has been no inflationary increases for many years. But you never know. Because of COVID, I'm hoping that they'll start to see the value of public health and maybe they'll change their mind on that. Certainly, we can all push for that. Anyway, for the cost, the total amount, I can't believe all the work that's done with that money. Other people may think it's a lot of money, but I know that you're creating miracles with it because it's not that much money, and yet the entire health of the city is improved by it. And I just want to say it's a work of magic of trying to squeeze it all out. So I want to thank Lou for the work on that and Dr. Etches on the fact that it's going to accomplish so much and not easy times. So thank you.
Thank you. We have a very dedicated team and everyone's been working hard for a long time. And that is unsustainable. I mean, that is partly why we are growing the team, is because we need to have an approach where people aren't going to get sick and leave or have difficulties maintaining the response. And so we're trying to get to a more sustainable pace. And but I will certainly provide your recognition back.
Thank you.
Thank you. Member Gower.
No questions for me, Mr. Chair.
Okay, thank you. Member Alfantiri.
Thank you, Mr. Chair, and thank you, Lou and Dr. Atchis for the presentation. Dr. Atchis, we know in other departmental, we have physical separation for our staff to make sure if outbreak happen or something happen in the workplace, we have our staff the separation so that we can continue have. And I don't know if you ever said that to us before, but I'm curious to know. Like, I understand what the bylaw does, what the police does, public works. They separate their shift work from A to B. Do we have similar separation in our staffing?
Yes, I can see if anyone on the team wants to describe more, but what we do is similar to the rest of the city, and what we recommend for all workplaces, which is we start with screening requirement. So every person must screen before they come to work to look through the list of symptoms or risk factors for having come into contact with COVID. And if they don't pass the screen, then they need to stay home. We're actually encouraging most people to work from home, as many as they can also, and facilitating that as much as we can. When people come into the workplace, we are expecting and supporting people to wear masks wherever they're in an indoor space with others. And when we have a clinic, that's where we use the plexiglass, where sneeze guards, I guess, and our immunization, dental, and sexual health clinics. We are reinforcing other things that could help with decreasing exposures, the physical distancing in the workplace, and we have markings, it's tape on the floors, to remind people about how to stay apart. We have also removed chairs where people might congregate, and we've put hand sanitizer throughout the workplace as well. So there's many different things we try to remind people regularly that they can do to limit transmission of COVID in the community. And again, invite the team if there's anything else, but we've created policies and procedures, and we'll continue to support. We did provide employees with masks earlier, and we're making use of other things like virtual care where we can, also to decrease the need for in-person contact.
The reason I ask you that, that must be create some budget pressure as well, to be able to keep staff on hand and do that separation, and in case one team.
That's in the budget. There's been a little bit more spending on supplies like hand sanitizer and also information technology. So people need to have laptops to work mobile and from home. So there are related costs on supplies.
So my other question, when we talk about the city contribution, so do we calculate all the city support calculation so we can recover that from the province? And is that, as you know, some departmental in the city lost revenue, lost transit revenue, such that. So we calculate all those extra or increased costs to recover that. So when the city support public health with staffing, do we calculate those costs so we can ask the province for reimbursement?
I think that one is a mixed picture. So some of the support from the city is in kind. Certainly, I must give a shout out to the Human Resources Department, which has helped us onboard so many people and reorganize our structure for an more efficient response. The information technology team, that's helping us in so many ways I've mentioned. That is mostly in kind. When we have brought over recreation and culture services staff to work with Ottawa Public Health more recently, they are being our budget, the Ottawa Public Health budget, and so then we would submit those as COVID expenses to the province. And the number of people who are formally redeployed has changed over time. So the number was higher in March and April, dropped off in the summer. Now we have some people helping us again in some ways, but it's mixed. But we are where we can. We're looking at provincial funding.
So my question about the budget is in your professional opinion, and I know without having the crystal ball, obviously none of us, but is that sufficient what we're asking in this budget if to receive that from the province? Is that sufficient to carry us on, as we heard, till at least the end of July, because some of the funding will change for the nurses in school? Is that going to be, or we might come back in 6 months from now and ask for more?
I hope not. I want to, again, sort of like I do with people who ask about the COVID situation, say that it's in your hands, literally. Individuals doing their part will decrease the demand for our contact tracers, for example. Some of the costs will, we need to maintain. But it does, if we have fewer need to do contact tracing, outbreak management, that will help. We'll report to you if we're looking like we're needing to spend more on the response. But this is our best plan based on what we see we're needing to do right now, and knowing that the virus is not going anywhere.
Okay, thank you very much, Mr. Chair. Thank you, Dr.
Thank you.
Thank you, Lou.
Thank you, Member El-Chantiry. Yeah, no, I think that Dr. Etches and Lou's team, I mentioned earlier on, there was a lot of backing and forthing and a lot of question asking. So I think they've done their best to sort of look at that what if scenario to make sure that we have the dollars. But again, COVID is a novel experience, but we will keep the board posted if we see a significant change, either way, in terms of how things are going. And the other thing I'll just say very quickly to your first question, I've used the Constellation offices of public health quite a bit since the beginning of COVID. Just because of so much of what I'm doing these days is public health related, and I can attest to the protocols and the processes and policies in place. It's so professional, and there's no there's nobody wearing the mask hanging down or not wearing the mask or jamming onto the elevators or anything. I mean, it's everybody is dedicated to walking the walk and talking the talk, and if we're asking other people to do it, then we're doing it first. So it's definitely in place, Member El-Chantiry. Not to worry about that.
Actually, I asked the question because I'm sure that will create cost impact on staff, and because when you have to separate our staff from one group to not to mix with the other group, like we did in policing or public works or fire or paramedic, so that is a pressure. That's a budget pressure, in my opinion.
Yeah, absolutely. I know the model the police uses where we don't do that. Like, police physically have, as I understand it, members who are staying home, so to speak. So they're almost like they're in reserve. We don't really have the bandwidth to do that, or the trained professionals to do that. But we are taking extraordinary precautions within the workplace. And again, as Dr. Etch is saying, encouraging as many people as they can to work from home so that those contacts are limited. But yeah, no, I know the model you're referring to with the police. It's a different kind of model for sure. Any other questions, Member El-Chantiry?
No, thank you, Mr. Chair.
Thank you. Vice Chair.
Well, congratulations to Lou and the team. What an unprecedented budget for an unprecedented time. So I know that I'm sure it took a lot of effort and modeling to pull together. I support the 0% assumption of base increase from the ministry. I think that's it sounds like a crazy assumption, but I think that's probably realistic. I do worry a little bit about a full amount of reimbursement for extraordinary costs. But you know, I trust that you have your channels of communication with the other public health units. And so I don't know how else you would present a budget without, but it is a bit of a worry, but nothing further for me.
Thank you.
Great, if I may,
sorry.
I would reflect back, you know, that we are one of the more hard hit areas. You know, so when they look at what other health units are having to spend per capita, we may be higher, and they may be lower, and so there may be room to accommodate the different budget requests in the provincial approach.
So it's like justifiable, is I guess what you're saying.
Well, yes, or that they're not necessarily trying to fund this level across every health unit. So it may be more affordable than just imagining this is the situation and the kind of response needed everywhere. You know, we know they've had very, very few cases in some parts of the province.
Perfect, thank you.
Thank you. Member Kuche.
Merci beaucoup, Monsieur le Président, and thank you, Lou, for the budget. And in the past, well-deservedly, we've certainly shown our appreciation to the medical and professional staff at OPH and the communication staff. Well, thank you, Lou, to the admin staff, and Dr. Etch has talked about HR, the finance staff at OPH that has done an outstanding job in very difficult circumstances. So yay, accountants. I have a couple of questions. The first, for the 2020 budget, the forecast, the budget last year was 74 million. It is 84 million. We are early November. You did this budget mid, it's always changing. Might be a week old, 2 weeks old. How firm are that $84 million forecast to December 31st, Lou? What's your degree of confidence in that?
Yeah, so out of that $84 million, it came out to a projection of a $12 million over expenditure to the ministry. And that was before we even stood up that we were planning to stand up some core services. So that number could even increase a little bit more to the end of the year. It could even get maybe up to 13 million. But to your question, we haven't closed October. We're just about to close October, so we'll have more data on that. But as of the end of September, we were running about $7 million over budget at the end of September. And we're running about $1.5 million or so over our budget on a monthly basis. So to the end of the year, you know, we were tracking into that $12 million range, $11 to $12 million. So we're pretty confident that the numbers that we put out earlier on, we're on track to pretty much hit those numbers that we've included.
Thank you. And again, for 2020, you have a certain degree of confidence that the provincial government will cover those extra COVID costs.
Exactly. They have they've announced, as I've said before, $100 million that they were going to fund health units across the province, and you know, we've all put in our initial estimates to the province, and as Vera indicated earlier, November 13th, we would have to refine that and submit a further update to the ministry. And so we're not that far off with what we put in, and we're hopeful that we're funded for the full amount that we've put in for.
Thank you. On to the 2021 budget. It has a $24 million increase over the budget from 2020, or a $14 million increase over the forecast. Is that for assuming a COVID response for all of 2021? Is the fundamental assumption that we will be dealing, OPH will be dealing with COVID for 12 months in 2021?
Yes, correct. It's that was the only assumption that we could make, and Vera made the point that and as the chair did, if miraculously we get out of this before the end of the year, then we'll spend less money, and that's the situation that we're all hopeful for. But this is a 12-month budget in front of the board, and that's our best estimate as of today's information.
Agreed, one can only hope. Just one more question, and it's just with, you have 511 full-time equivalents for 2021, the same as 2020. Is that because the estimate is too difficult to come up with? I presume that there will be more staffing and full-time estimates as a result of this these expenditures.
Yes, and that's what that 24 million is a majority of that is staffing. We don't show it as full-time equivalents because they're not base positions. They're one-time positions for a duration of a year. And so once we've completed COVID, then these positions, as the funding, will come off the books. But as of now, we don't show them as a full-time equivalent because it's not base funding that we're talking about here.
Okay.
And just to be clear, we've counted each and every one, and we've double checked that we don't need them, and we've tried to make that number as small as possible. And it's a very, very hard fought list of different, skilled people that we need to bring on that's captured in that 24 million.
I agree, and I fully support that you need to get the resources that are needed for you to provide the services to the residents of the city. And so I fully support it. It was just for that number, which was the same, struck me, and I just wanted to know how it was being presented. And I'm sure there's another spreadsheet somewhere that has quite a list to it. Thank you, Dr. Etches. Thank you, Lou, and thank you, Chair.
Thank you. Dr. Etches, or Lou, maybe you could also just mention quickly that yes, it is a COVID response, but further to what you had said in your opening remarks, Dr. Etches, that there's also a move to, I don't know if the word is rejuvenate, but to support some of the core services that we've sort of been diverting. Maybe you could speak to that a little bit as well to answer Member Cloutier.
Yes, so we have redeployed such a large proportion of our team. You'll see that in the budget report, that we took away from our services that we would normally be providing across the board. Almost every type of service had been reduced or stopped completely. And so we can't continue that for another year. We know that there are services that we uniquely provide, and services that really need to be in place. And so we are working to stand more of those back up, and we'll continue to do that as the COVID response allows. And so if we pull people back from COVID to do the essential services, then we know if the COVID continues, we have to find those other people to do the work, either paying to hire them or drawing from the provincial source, as they are giving us some people for contact tracing as well.
Thank you, Dr. Etches, for that further sort of context to how our budget got to where it is. And finally, we have Member Banham.
I just want to say congratulations to Lou and the team. I do want to say that in a year where different services percentage of budget has been called into question, it has also given the opportunity for the percentage of budget of OPH or public health to be disseminated a bit more. And I've heard time and time again that's amazing how much public health does given the limited resources that they have. And so I think that information getting out for public health is a really great communication tool for gathering support amongst the public. And so I just wanted to say it's incredible the amount of work that you do with such limited resources, and I fully support what you're putting forward. And I think it's amazing that you are planning to respond to COVID in 2021 with this budget, and keep up the great work. Thank you.
Thank you. So we now have to vote to receive and table the draft 2021 operating budget. Carried?
Carried.
And then recommendation 2 that we'll be voting on is direct staff to forward the 2021 draft operating budget for the Ottawa Board of Health to Ottawa City Council on November the 4th, 2020, as part of the City Council's tabling of the City of Ottawa 2021 draft operating and capital budget. Carried?
Carried.
Just a quick question for Deanne on recommendation 1, which we carried. Do we also have to say indicate that we've received as well?
No, that's fine, Chair.
That's fine. Okay, thank you. So I believe that was the last of the items that we held.
Yes, we can go to the motion to adopt reports.
Okay, Member Tilley, please.
Sure. Be it resolved that the Chair of the Board of Health verbal report, the Medical Officer of Health verbal report, and the reports titled Ottawa Public Health Submission to Health Canada on Proposed New Regulations for Supervised Consumption Sites and Services, 2021 Ottawa Board of Health meeting schedule, and performance appraisal of Medical Officer of Health in camera, personal matters about an identifiable individual, reporting out date, not to be reported out, be received and adopted. And be it further resolved that the report titled 2021 Draft Operating Budget for the Ottawa Board of Health be tabled for consideration at the Board of Health meeting of November 30th, 2020.
Carried?
Carried.
Thank you. Are there any motions requiring suspension of the rules of procedure? Okay, thank you. Are there any notices of motion for consideration at a subsequent meeting? Thank you. On that note, if anyone is considering any motions with regard to the budget meeting, if they could get them to Deanne's attention sooner rather than later, that would be much appreciated. So staff has a full opportunity to review and consider them and see if their staff supported or what additional work they might have to do to respond to a particular motion. That would be greatly appreciated by all members. Member Tilley, confirmation bylaw, please.
Be it resolved that confirmation bylaw number 2020-5, a bylaw of the Board of Health for the City of Ottawa Health Unit to confirm the proceedings of the Ottawa Board of Health at its meeting of November 2nd, 2020 be read and passed.
Carried?
Carried.
Okay, thank you. Are there any inquiries from members? Okay, thank you. Member Tilley, adjournment?
I don't know that I have that in front of me, but how about I take a shot at this? Be it resolved that the Ottawa Public Health Board of Health meeting of November 2nd, 2020 be adjourned. Does that work?
Carried, I think it does. Our next meeting is November the 30th at 5 p.m. And before we close, I just want to remind any media who may be watching this meeting on the YouTube live stream, they will have a Zoom media availability 15 minutes after adjournment. This replaces the post-meeting scrum that would normally happen after in-person meetings. If not already registered, media representatives wanting to participate can email ophmedia@ottawa.ca. Thank you all, and we'll see you on the 30th.
Bonsoir.
Thank you.
Bye, all.
Bonsoir.